Okay.
Hi, I'm Bob Schrupp, physical therapist,
Brad Heineck, physical
and
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Julie, how come you didn't chime in? You're supposed to say something.
They are the most famous.
Thank you.
Yeah, we got to pay a recorder. All right, we already did a video, Brad, on Lymphedivas, kind of a review of the pressure garment that you can use after lymphedema.
Lymphediva.
Lymphedivas.
That's okay.
Yeah.
Divas.
Oh, you want me to pronounce it better?
Well, I want to. Yeah.
So, okay, I'll put the words down here too.
Okay.
Anyway, now that we've done that, we want to also have a video on show how to measure for their garment
Sure.
and how to apply it.
Right. Yep. So if you want the garment, you just can't buy one off the shelf. You got to get the
Right.
right one.
These are, I would say, semi-custom. They're pre-made, but they find out which one would fit you the best.
Right. And you'll see by the way we measure it.
Yeah. All right. Let's start off with the measurements here. All right. The first measurement, if you're going to need the garment to go into the hand, they have a part that's called the gauntlet, which we had much discussion about that.
Yeah, like gauntlet.
Yeah, anyway, that'll go over it won't cover the fingers, but it does cover the hand. So if you do need that portion of it, what you're gonna measure is, and Lonnie, maybe you're gonna wanna get closer here, or do you want us to come closer? How's that?
That's too close.
That's
Too
too close.
There you go.
And by the way, for all you bachelors out there, you can see she's married, so it's back
Yeah.
off, yeah.
Long time.
A long time. Julie's, I would say Julie's a lot older than you would think she is. And I don't think we're gonna reveal this, but we should maybe have people guess in the comments, because you're gonna be shocked at
Let's
her
get
age.
measuring.
Oh, yeah.
Bob.
All right, anyway, right below these knuckles, or right around the knuckles, I'd say right below them, you're gonna measure, pull it slightly tight, all right, and then you can give it in inches or centimeters. All right, while we're here, we're gonna go one right around this bone here too.
The gauntlet goes from the knuckles just to the wrist.
Yeah, but the rest of the garment starts here, so
Sure.
you need to have this one no matter even if you're gonna have the gauntlet or not. Again, kind of pull it slightly tight, all right? Then we're gonna go to the meaty part of the forearm, and the largest part of it. And take it, and again, pull it slightly tight. All right, then we're gonna go up to the bicep, again, the biggest part of the bicep, which on Brad would be about 5 inches. Anyway, on this one, you're gonna pull maybe a little more than slightly tight, because this
Okay.
one you want to grip pretty well.
We don't want it to slide down.
We don't want it to slide down,
Right.
so, okay, those are the measurements you're gonna take, and then the final one you're gonna take is from the armpit all the way down to the wrist. Okay? You
Okay.
got those, Brad? You got them memorized? All right,
Say no
Julie,
more.
come on over. What's cool about this, again, they've really have meshed fashion and function together.
Right,
This is
right.
really a beautiful solution. I really admire this company, what they're doing.
Sure.
They really have come up with, I think we've all been touched by breast cancer to some extent. I think we all know people.
Right,
My mother-in-law, my mother-in-law's sister, I just had an aunt. So anyway, what's cool is it comes, there was a whole box and everything, but I just love this tissue paper that it came in. Isn't that cool? So, and then this was one of the garments. We're gonna show, Julie's gonna put this garment on, and then we also, I have a little video clip of me putting the garment on one of our patients. So first, Julie, before you start, this was folded in over itself, on itself. Is that how you describe it, Brad?
I think the women will know, because when you put nylons on, you kind of do that, is that right?
Yeah.
Julie, you'll do the same
So you
technique?
fold it kind of half over itself,
Yeah.
in half. over
Bob and
itself.
I were kind of out of our.
Yeah, we're out of our,
Let's, Julie, go ahead.
yeah. Now, if you need help, we'll help you, because Julie does not have lymphedema, but this does seem to fit her to some extent.
This was not measured for her, we just got
Right.
it as a demonstration
Right.
piece. So look at that. Not bad, is it, to put on?
No, it's not that hard.
But, you know, if there's someone else around the first time or two, you may wanna.
So it's
size that
actually a
one
little
up.
bit long for you, because this probably would hit right around on the wrist if it
Okay.
came on. So you need to grow your arm just a little bit longer.
Yeah, we'll stretch it out.
So now, again, with lymphedema, there's not gonna be any concerns about, that you're gonna have pain pulling this on. In this, I want to disqualify this on this next little clip where when I'm working with this patient, she had a total shoulder replacement, which is often quite painful. And she's got some lymphedema in the forearm that's just been stubborn and won't go away. And so this was really a great thing to try on her. And, but as you're gonna see, I'm putting it on her, this is blind, I did this, you know, I didn't do a practice run on her, and she does wince a little bit, so there's a, you know, there's a little bit of pain pulling it on, but I don't think that's that unusual. The other thing, I just called her, and you guys verified, I just called her, she thought it was very comfortable and very helpful, she really liked it. So, and she's gonna see this video, so I'm gonna say hi, Selma. So we'll play that next, and then we'll come back and do our little goodbyes.
Okay.
Okay, we're here with Selma. Selma had a right total shoulder replacement, and she also is having a little bit of swelling in that arm. Specifically, mind if I show Selma?
Maybe she did it.
Specifically, I know Lonnie, if you can kind of zoom in a little bit, but this right here, you can see, this is kind of a hardened area, and it's just kind of a little bit stubborn, isn't it? You know, we want this to flow back up into the body here, the lymphatic system, so. You go ahead and have a sleeve, picked out here from the Lymphedivas, and it's the hummingbird, right?
Do you know what it is?
So this is the first time we're putting this on, so if we're clumsy, but you're supposed to fold it in half, and I'll show this on the other part of the video too, but we're gonna go ahead and slip it in here. See how far this goes the first time. How's your shoulder holding up? Okay. Go a little bit further yet. It's tight, isn't it? Okay, you okay? Okay. This should be down right around this bone right here. So now we'll slip this up. You can grab onto it if you want to.
Yeah.
Fortunately, you can't see the hummingbirds, they're over here. Next time you put it on, you may want to probably slide up a little bit more. Probably should have started it.
Kick out to the side.
It's hard to get a hold of.
Yeah. It has to be tight. Yeah, that looks pretty good. I like it because it's a lightweight material,
Yeah.
and well, aren't you going to be the fancy one here? So,
It feels okay.
good, good.
It does.
Should keep that one warm anyway in this, what are we at, 0 degrees here today? So, all right, well, thank you very much, Selma.
You're
And
very welcome.
we'll check in with you in a couple days. Just real quickly, we also put on the, they call it the gauntlet portion, I think. Yeah.
Yeah.
And so you can see how that looks too. You're not really having trouble with swelling in the hands, so we probably won't have you wear that, but it does kind of look cool.
Yeah,
So
yeah.
keep your hands warm anyway, so.
Yeah.
All right, thanks, Lonnie. Okay, and we're back. A couple things that we had failed to mention. This comes in basically class 1 and class 2 as far as how much lymphedema pressure, I mean, how much pressure it puts on the
Right,
lymphedema.
right.
Was it millimeters of mercury?
Millimeters of mercury, it's 20 to 30 is class 1, 30 to 40 is class 2.
Which you may need a prescription to
Right.
get that one, I believe.
This is something we're pretty much assuming that you're not just gonna see you got a swollen arm and order it. You really should get some intervention from the medical profession, a doctor and a
Right,
therapist.
somebody helping you
Yeah,
along.
to get you started.
Because you really want to get the lymphedema down first before you even get fitted for this. You know what I mean, you want to get it down to some extent, because you want it stable, so that this will hold it in, on that level.
Right.
I want to make sure you also watch the other video, if you haven't already, on Lymphedivas, our review, because we show all the different styles on there, and right there, if you click on that, that'll take you to that, so.
They really got some nice designs, and
Yeah, really cool.
I'm thinking people would want to wear it even if they don't have lymphedema.
Yeah.
They really are nice looking.
My patient Selma, that was the hummingbird design, by the way, she had
Sure.
little hummingbirds on there, so. All right, thanks a lot, and if you haven't already, please subscribe.
You better believe it.
Thanks.